Yes, that was my cue. Good morning, everyone, and welcome to our diversity engagement survey speaker series. This is part two of a three-part series called Conversations in Designing and Implementing Data-Informed Strategic Plans and Accountability Measures. I'm Marlena Duncan. I'm the Vice Chancellor for Diversity and Inclusion and Chief Diversity Officer here at UMass Chan Medical School. The Diversity and Engagement Survey was developed here at UMass in collaboration with AAMC. And the goal of this survey was really to measure how well academic medical centers were responding to diversity in their community by measuring the academic medical environment through the lens of DEI. And the DES really provides institutions with data on the level of the active engagement of their members, their inclusive characteristics, and the degree to which diverse groups experience inclusion. So this morning, we have the pleasure of hearing from a panel of DEI professionals from across the country, share their experience with using the DES at their medical institutions and the impact that the survey has really had on making changes at their institution. So the goal of this morning's conversation is really to build a community of practice, us having an opportunity to share challenges we've had, but then also success stories. How have we actually used this data to inform our conversations and our practices at our individual institutions? So I personally like to thank our three guests for being here this morning. We appreciate their time, their talents, and just sharing their experiences with us. I'm now going to turn it over to Dr. Sharina Pearson for some opening remarks.
Good morning, everyone, and I would like to just echo Marlena's welcome to you. My name is Sharina Pearson. I am a professor and vice chair of the Department of Population and Quantitative Health Sciences and one of the original developers of the DES. I'm also responsible for its administration now. The DES has been administered over the last 10 years now. With over 85 administrations encompassing about over 150,000 respondents. It's been implemented both nationally and internationally, and has been found to be a valid and reliable measure. And so anytime we have the opportunity to really expand on its use, to get together a group of thought leaders who have used the DES, who plan to use the DES, are thinking about using the DES to really get together and talk about best practices is always a great thing. And so I am very happy to see this day come, and hopefully you all will also get some great results as a result of being at this event. So thank you very much. Now I'll turn it over to Angela, I think, who will continue.
Hi, everyone. My name is Angela Printy. I am the data analyst for the Diversity and Inclusion Office at UMass Chan. First, I want to say welcome. We're all really excited that you're here. It's been just a lot for us to get us all together. We're all finally excited that it's time for our little conversation. So first off, we wanted to hear from you. We wanted to make sure that you're getting the most out of this time. So we have actually created something called Slido. It's just a quick little poll to find out, what are you looking to learn from today's discussion? So if you guys are handy with the smartphone, you can go ahead and scan the QR code, and it will give you an opportunity to put in some of the things that you might find to be really interesting or what you're looking forward to getting out of this conversation. If the QR code is not for you, we do have a link. And Candace, if you wouldn't mind just resending it for those who were not in the meeting when you sent it, you can go ahead and put your information, whatever you'd like, right into the Slido that way. And so I'll give you just maybe a minute. You guys can type your things in there, and then I'll go ahead and introduce our speakers. Okay, great. So it's been about a minute. Feel free to continue to add things into the Slido as we continue. We'll make sure to keep our eye on it. Hopefully we can have our conversation and panel discussion be guided by the things that you've said in our Slido poll. Next, I'm just going to let you know a little bit about what we've got going on for today. So, we're going to have our speakers speak, tell you a little bit about what they have going on at their institutions, how they've used the DES. Then we're going to have that followed up by a panel discussion that's going to be moderated by Dr. Hernandez. And then we'll have a time of question and answer. After we wrap all that up, we're going to have a time for you guys to be able to talk to each other, discuss what maybe some of your challenges or some of your big wins when it comes to the DES. And then we'll wrap it up with just a quick overview at the end, okay? Great. Okay, so it's now time for me to introduce our panelists. Like I said, each of our panelists will talk about the ways that they have uniquely used the DES at their institutions. And then, like I said, it will be followed up by a panel discussion. So first we have Dr. Mona Pao, who is a professor of medicine and director of the Division of Preventative Medicine at the University of Alabama. She also serves as the founding director of the UAB Minority Health Disparities Research Center, and she is nationally recognized as a leader in health disparities research and is a member of the NIH National Advisory Council on Minority Health and Disparities. Next, we have Dr. Carolyn Belcher. She's a professor of pediatrics who is jointly appointed in the Johns Hopkins University School of Medicine and the Johns Hopkins Bloomberg School of Public Health, Department of Mental Health. She is currently the director of the Center for Diversity and Public Health Leadership Training at Kennedy Krieger Institute. Finally, we have Dr. Jaya Esola. She's the Assistant Dean of Inclusion and Diversity at the Perelman School of Medicine and the founder and executive director of Penn's Medicine Center for Health Equity Advancement. And she also serves as the Associate Professor of Medicine and Pediatrics. As an Associate Professor of Medicine and Pediatrics, her research centers around evaluating system, provider, and patient level strategies to improve uptake and quality healthcare for marginalized populations. So without further ado, Lynn, if you would take it away.
Hi, good morning, everyone. So we are going to go ahead and get started with our panelists. So Dr. Fod, I believe you're going to present some slides.
Thank you so much. Let me share my screen. Can you see my slides? Okay, thank you. First, I would really want to thank the opportunity for presenting today and talking about our experience utilizing the diversity engagement survey, and like with the survey that was done just a minute ago, to use it as a guidance for us to develop our strategic plan. So I'm just going to talk a little bit about who we are, and then the initial assessments with the DES and what initiatives we did to address what we find. And then we did a follow-up assessment to see how these initiatives impacted our results and conclusion. So I'm not going to talk about DES. I think it was presented a minute ago, but I serve as the Senior Associate Dean for Diversity and Inclusion for our Hersing School of Medicine. And our mission is to pursue excellence in medicine at UAB by cultivating an accepting and affirming environment for all in education, research, and patient care. So, we were lucky that actually the office was established in late 2014. So we did not have a coordinated efforts for diversity and inclusion. We had for the undergraduate, we had a little bit for trainees, but not an overall one. And I was appointed as the first senior diversity and inclusion officer. So we didn't have anything to know what's going on in our School of Medicine, and we wanted to do assessments to guide our strategic plan. So we did some quantitative and qualitative research. We did more than that. We did a lot of focus groups and other things, but the main thing that were like studies, we did a qualitative study to know what are the barriers and facilitators for women and underrepresented minority faculty. And this was published in the International Journal of Medicine. And we did also some surveys because we wanted to increase diversity of our residence applicants in our institution. But today I'm going to focus on the diversity engagement survey because that was really the main driver for our strategic plan. So you developed that, in UMass, that for the diversity engagement survey, we wanted really to know the perception among students, faculty, and trainees. So the first step in 2015, we implemented the survey and we administered it to faculty, students, residents, and fellows. And then based on the findings, we implemented programming. And then in 2018, we did a follow-up. In that one, we included staff, but when we did the comparison analysis that I'm going to show you now, we excluded staff because we didn't have a baseline forum. But now we still continue for sure to improve our efforts, especially in the trust area. So you know about what are all the clusters in the DES, from common purpose to access to opportunity, equitable rewards like compensation, cultural competence, trust, sense of belonging, and appreciation of individual attributes. And most important, I believe respect is very important too. So this is something the UMass team know, and Dr. Pearson and the analyst, that we were very pleased to use that because also we were able to segment our results by gender and by URM and non-URM. So based on that, we had to develop some initiatives that addressed some of the findings that we had. Like one of the things that we identified, actually, I pulled out a lot of data of slides that I had because I knew I had only 10 minutes, but we can talk about it in the discussions. Women really were the ones most feel like they are not getting the same opportunities as men. So we developed initiatives for women. We have now the International Women's Day lunch and lecture, and thus we invite a role model of successful woman in academic medicine, meets with young faculty, but also give her story about how she reached where she is. We established the AMWA chapter here, the American Medical Women Association, and it's very, very active now. And also we decided to do group coaching. We call it Transforming for Success. It's like those executive coaches, but we did it group for junior and mid-level women, like for career management, for negotiations, like all these executive leadership programs that is out there. And the chair of the departments were really very enthusiastic about that. Our office, provide half of the tuition for each faculty, and the department chair provide the matching funds. And we wanted especially to do that because we wanted the buy-in and of the chairs. The other thing that we did, we wanted to be transparent, and you can go to our site. We have a diversity dashboard that every year it's updated with the makeup and the recruitment of our faculty. It shows by department, by division, the demographics of all our faculty. And all the department chairs use that to report in their annual report with the dean about how they're doing in their diversity. We started a women's equal compensation study, and we also have an annual diversity lecture. To get the community engagement, we have an annual diversity fair where every department developed like a kind of a food that represent the culture in their departments, and we have a competition, and we give awards to the first and second and third winners in our departments. And our dean's leadership in the school and the UEB are the judges for the tasting and the presentation. This is really something fun that all departments participate in. We have a women's promotion reception where we recognize women that promoted to associate and professor. We established a diversity faculty associations for African American, Latinx, for Asian American, and for LGBTQ. We have a students advisory board. We developed diversity liaison, a faculty from each department to be our advisors. We have a diversity council. We have a lot of communications, website, newsletter, and we develop training programs. Some of them are unconscious bias training, and we have an online program called the Common Thread. This is just highlights, but all this was, each initiative of those addressed something we found in the DES. This is just some photos to show you some of our people and activities. So we did a follow-up assessment in 2018, and I can walk you through this, but if you can see, like between 2015, 2018, we improved in almost all those clusters. From the common purpose, vision and purpose to appreciation. The only thing we really improved but was not statistically significant is the trust issue, and a little bit of a sense of belonging. So you can see that we waited about 2 years to see, we didn't do it like a year after or 2.5 years to see the impact of the initiatives we did, but we were very pleased. And the response rate was about 31% or 32% the first time, and about 37% the second time. I pulled some of the slides of the data, but half of our respondents were faculty. We had 50-50 by gender, and we probably 30% were students and 20% with residents and fellows. Also, we moved in the benchmark compared to other institutions, which this is something really we like about the DES because it shows us where we are in the nationally. And you can see we moved from the lower quartile to the upper, like 50 to 75% in many also clusters, access to opportunities, equal rewards, cultural competency, camaraderie clusters, and appreciation, respect factor. We were moved. The ones that we stayed the same were vision and purpose cluster, the common purpose cluster, and the trust factor. So we know that now also the DS showed us what are the areas that we need to work on. This is just some, I'm just pulled a little bit to show you that we still improved. This is just for URM, and we have data for sure. You do the analysis and you know that there's data by gender, by URM, and others that, for some things like I trust my institution, to be fair, we had some improvement here in both male and female. If I raise a concern about discrimination, I'm confident my institutions would do the same. So we really did. We saw also in the qualitative some improvement in some things. So with that, I'm just gonna stop. I have a lot of other information, but to give other panelists the opportunity to present. And then I'll be glad to answer any questions you have. Thank you.
Fantastic. Thank you, Dr. Fod, for sharing your experiences with the DES. So yes, so if you have questions for our panelists, we're going to ask that you hold them to the end until everybody has presented, and then we'll have a question and answer portion. So I'm going to invite now Dr. Belcher to present.
Right, thank you very much. Let's see. Hopefully get our slides. And let me know, can you see the slides? Okay, well, again, thank you very much. And thank you, Dr. Fudd. That was a great introduction, so that I could just kind of jump in from there, because I did want to share a little bit about the Kennedy Krieger Institute, because we often say we're an N of one. And so we are, we have a quadruple mission, in that we're a training institution of graduate students and undergraduates in the medical fields, particularly the maternal and child health field. So not only do we have pediatrics, neurodevelopmental pediatrics. I'm actually a neurodevelopmental pediatrician, so I focus on the care and treatment of children who have developmental disabilities, but we have physical therapy, occupational therapy, speech and language therapy, nutrition, clinical psychology, neuropsychology, the whole, all 15 of those disciplines are coming in. So I'll talk a little bit about kind of the diverse interdisciplinary approaches that we use and what we wanted to do. As well. So I am the Vice President and Chief Diversity Officer. This is a relatively new position at the Institute starting in 2020. I've been doing this work kind of independently through training of diverse scholars for the last 30 years or so. So we formalized it. And one of the things the DES has helped us to do, and I'll sort of give you kind of historically how we got connected with the Diversity Engagement Survey, is it helped us to really look at our mission and vision statement. And these are our revised mission and vision statements, where the mission is to transform the lives of children, youth, and adults, and those at risk for who have disorders in the nervous system through innovative, equity-based, culturally relevant clinical care, research, education, community partnership, advocacy, and training. So training is where the Institute started, but we provide clinical care for about 25,000 unique patients, research, education, and advocacy for those with or at risk for developmental disabilities. So diversity and cultural linguistic competency are foundational in the services that we do provide and strive to provide. So we envision a world where the Institute will continue to lead with intention through innovation to provide equitable, relevant, and effective clinical care, research, educational interventions, training, advocacy in partnership with the community to improve the lives of all individuals who have or at risk for disorders of the nervous system. So as I alluded to, actually Kennedy Krieger Institute is the oldest and largest LEN program. LEN stands for Leadership, Education, in Neurodevelopmental Disabilities and Related Disorders. Our primary focus of the LEN programs are in training. As I said, it remains the largest in the nation. We are part of the AUCD, the Association of University Centers on Disability, and we have 3 of those separate components: the LEND, the UCIDS, which is the University Centers of Excellence in Developmental Disabilities, and our UCID is the Maryland Center for Developmental Disabilities, and it has an advocacy focus. We also have Project HEAL, which is Health, Education, Advocacy, and Law, where we have lawyers who work with families and in the community to ensure that individuals and children get the appropriate educational and advocacy services. And we also have an NIH-funded IDDRC, which is Intellectual and Developmental Disabilities Research Centers, and it's a research focus. So we have the training, advocacy, research, and then we provide care for many children in the Maryland, DC, Virginia area, nationally and internationally. So foundational in our programs are just in alphabetical order, not in order in their importance, but really advocacy, community, this continuum of care through this interdisciplinary approach, inclusion, always excellence and equity and evidence-based practices. So you can see we have a wide range of services. And when I came into this current leadership role, I wanted to be sure that everyone was engaged, and all of the individuals that work at the Institute as part of the team felt that they were included and heard. I really, I don't like the word minority. I think no one is a minority. So we talk about maybe we're underrepresented in medicine or underrepresented in public health or maternal and child health. But I tell people that no one is a minority. We all have value. So we really, as I started out in this position, I wanted to hear from everyone. So these are some of our institutes. We have a hospital in this particular building. This is one of our the first buildings that we had. This is our outpatient clinic. We have a school. So we provide level 4 and 5 services for children with intellectual and developmental disabilities and mental health. So kind of this intersectional identities, preschool all the way through high school age. We have specialized programs, parent and community together, where we provide medical and daycare, childcare services for children with intellectual and complex medical conditions. And this is our research and training building. I have an office in this particular building. So as I said, the office, we call it OHEED for short, because I really want to heed the word, not just listen, but really be engaged myself in the work that we do, our team. So the Office for Health, Equity, Inclusion, and Diversity. And our mission is to provide and create this evidence and equity-based resources that promote diversity and inclusion for those who work, train, conduct research, teach, learn, receive services at the Institute, regardless of their actual or perceived characteristics that we have. And we really want to use resources wisely and collaboratively across the Institute. We are a university affiliated program with Johns Hopkins University. There we have, I'm on faculty with the School of Medicine, School of Public Health, as you mentioned, and many of our professionals are on faculty at Johns Hopkins. But again, one of the important things when I was considering, well, what measure will we take for our 2,600 employees? What can we learn from them? How do we shape our mission based on those results? And I was looking through, I am a data geek, so I was looking through the research and really came upon the diversity engagement survey. It was very impressive. You hear the current statistics. When I was looking into it, it wasn't as many. Now it's over 100,000, almost double what it was when I started my journey. I was very impressed with the psychometrics, the approach of engagement, because it's fine to have diversity and inclusion, but is there the engagement, the leadership? I was impressed also. It was descriptive, diagnostic, and prescriptive. And I like that theoretical construct. It doesn't do any good if you're invited to the dance, if no one dances with you. And I thought it reflected the values that we had in the Office of OHEED, which first and foremost is excellence, but embracing change and integrity and being accountable. So this is our first implementation of the DS. at the Institute. And, you know, if you're in medical institutions, we're always getting a lot of surveys. So, you know, I was very pleased at the response that we received from that. We had, you know, over 700 of our employees across the workforce that participated in the study. We have the majority of our employees are women. So that's reflective in the demographics here, as you can see. And they pretty much reflect the demographics of our workforce. So that was very, very good to hear. And so, or to see actually. So this is just breaking it down by some of the inclusion factors and the, you know, this initial assessment, we were ranking pretty high favorability in a lot of areas. I think, you know, not to generalize, but individuals who work with those who have or are at risk for developmental disabilities, there's a strong purpose-driven mission. And so I think that was very reflective in the DS and kind of a very valid measure of what I feel the people that I've been working with for over a quarter of a century exhibit in their care for patients. Again, I think this issue of trust also for us, it was the equitable reward and recognition and cultural competence that we really wanted to work on. So I think in that sense, it's prescriptive. And then it also allowed me to look at the differences, again, as you had mentioned, the previous presenter, between the men and the women, and see whether there were statistically significant differences and in what areas. Here you go. Again, this theme of trust, the respect, appreciation, those areas, the culture was different for men. This is our Black African-American population comparing those with our white colleagues, and they were scoring lower across the board, which was very concerning to me, being a member of that group as well. We looked at the Hispanic versus non-Hispanic. This area of trust is pretty significant, and also those of our employees and workforce who had disabilities. So this just looks at it, you know, just based on the t-test, kind of looking at the differences between the various groups that I just kind of summarized for you on a high level. So this allows us to really focus on the areas. We have some areas of strength and favorability, but also there are areas to work on. The purpose, definitely, we're kind of a strengths-based. We have that across the group. We really do have that kind of uniform theme. But there are this equitable recognition here for the different groups. That needs to be an area that we're working on, as well as in trust. So these are areas where we're not getting the favorability scores that we'd like to get, and hopefully at the end of 2023 is going to be our 3-year anniversary. So we've already submitted, and hopefully through these activities that are kind of targeting these areas, we'll see some improvements and be able to demonstrate that. So these are the things that we did. We created an ideas council standing for inclusion, diversity, equity, anti-isms, and social justice. So we had an EDI steering committee. We've had that for some years, but it was only a few people. This ideas council allowed us to spread and have voice across the Institute. So we have 30 to 40 members from across most of the divisions. We've revised, as you saw coming in, those mission, vision, values, and culture of care statements, kind of thinking about what we saw in the DES. We started employee resource groups and affinity groups. So we have a women's leadership group. We have a Black affinity group. There are other groups that we're looking at. So in the area of kind of this recognition and equity, we increased our minimum wage to $15 for all our employees. We bolstered our intranet and internet resources to have resources in this EDI and support areas. We sponsor through OHEAD a quarterly grand rounds that is focused on EDI issues. We are getting surveys so we can share this, and we have like dashboards so people can go to different journal clubs, etc. We have built out our Center for Diversity and Public Health Leadership Training. We now have over a total of over $11 million of funding to promote diversity from undergraduates through medical, dental, pharmacy, veterinary medicine, all the maternal and child health fields. And we're working with the federal government in all of these endeavors. And then we're building mentorship, building within and building the bridge from our high school community in Baltimore City to the Institute. So there are a lot of activities, and I'm hoping that we might be able to see some reflection of that in our next DES.
Fantastic. Thank you so much, Dr. Belcher. Excuse me. So now I'm going to invite Dr. Isola to present on how she's used the DES. And then once Dr. Isola is done, then we can go on to questions.
Thank you, Lynn. It's great to be here with all of you this morning. And Lynn, just to keep me honest, when are you hoping to wrap up this part of it, by 10 or?
Please take as much time as you need to present your results, and then we can definitely make modifications on our end.
Okay, sounds good. Again, it's great to be here, and I'm going to limit praising the DS, but just to add my praise to the DS as all the other panelists did, and talk briefly about how we use the DS to essentially operationalize inclusion in our academic medical center. And I'm going to focus on our first set of benchmarking results when we administered in 2015, and some of the mixed method studies and results that original benchmarking action item that we had done spawned thereafter. And much like other panelists, we conducted our DES in 2015, and it seems to be the cadence of choice for the panelists to do it every 3 years. And we have also done it in 2018 and 2021. And we conducted this across Penn Medical's health system as well as affiliated schools. So we have 4 affiliated health schools, as well as 6 hospitals and several ambulatory practices. And so we administered it across our enterprise to employees, faculty, students, and trainees. And in 2015, we actually ranked in the bottom third for the cultural competency factor. And just to underscore one of the values of the diversity engagement survey, it allows you not only to benchmark with yourself if you're repeating the survey over time, but also to benchmark with other institutions or peer institutions. And so when we were benchmarked against peer institutions in 2015, we found out that we really placed in the bottom third, and we really wanted to understand that. And that sparked further evaluation at our site. And I'm going to talk a little bit about that in the remaining slides. So we did a deeper dive, again, on the cultural competency factor, which is a 4-item factor, which I'll spell out. And then we followed it up with a unique novel way of crowdsourcing narratives as a method of collecting qualitative data. And I'll explain a little bit why we did that over something else like focus groups or individual interviews in the Q&A or during the breakout sessions. But essentially, the reason why we leaned on this call for narratives was it preserved anonymity, and you wouldn't get homogeneity in thought like you would in a focus group, or fear for retaliation like you may in a focus group. And the only way to really do one-on-one interviews in terms of, or semi-structured interviews, would be with an external consultant, and that would be very expensive. And so we leaned on this crowdsourcing method. So we wanted to look at why we benchmarked low. So I specifically looked at the CCF score, which assesses organizational culture and capacity. Our CCF score, mean score was 15.3, and our standard deviation was really narrow. Our interquartile range and median was around the same place. So it allowed us to sort of dichotomize this variable to say, listen, did you feel like our culture was above average or below average? And then we were also allowed to look at all of our respondent characteristics and sort of adjust for that so we can get a deeper dive into why we may have scored lower than anyone else or in the bottom third. Just for those of you who are not familiar with diversity engagement survey, this is specifically the 4 items in the CCF factor, which is in this institution, I have opportunities to work successfully in settings with diverse colleagues. I believe my institution manages diversity effectively. In my institution, I receive support for working with diverse groups and working across cultural situations. And in this institution, there are opportunities for me to engage in service and community outreach. And so this is the only wonky slide I'll have on this, but essentially for those of you who are not familiar, this is a forest plot. It shows adjusted odds ratios. And if the line is greater than 1, that means you're more likely or have an increased likelihood or odds of feeling like your organization was cultural competence or ranking the CCF factor above the mean. And if you're below 1, you're significantly less likely to. And if you cross 1, you're equal to your comparator group. And what we found was that females as compared to males were significantly less likely to rank the organization as culturally competent according to this factor. If you were a sexual or gender minoritized group as compared to heterosexual, you were significantly less likely. And if you identified as non-Hispanic Black as compared to non-Hispanic white, you were significantly less likely also to feel like the organization was culturally competent. We did find that those folks that were here less than a year were blissfully unaware, perhaps. And we did see that when we looked at site-based differences, if you look at CHOP above here, that it did do better than the School of Medicine as a reference. However, when we did a deeper dive into why, doing a diff analysis, and I'm sorry, I'm being sort of data wonky at this point, we found out that those scores were driven by higher scores from white men, and so they actually had wider gender disparities and wider racial and ethnic disparities than some of the other groups. So we realized that we couldn't look at an exemplar site, and this problem was pervasive across sites. And that's what got us to want to launch this campaign about tell us your story of inclusion or lack thereof. And we used 2 open-ended stimulus questions to sort of elicit stories. And we got over 1,000 stories, and we deeply analyzed 318. And we also asked for respondent characteristics so we could stratify these stories. The submitted narratives were anonymous. They were stripped of any personal identifiers by our research team prior to analysis. And we had a diverse research team that really coded each of those stories, both on structure and content, as well as doubly coding it and then individually coding it. You know, we made sure our inter-rater reliability was high. We coded features of each narrative like introduction, presenting problem, complicating factors, resolution, moral and meaning, characteristics of the persons involved to allow us to facilitate equitable comparisons across narratives. And what we found was 6 key factors that drove a lack of inclusion or inclusion thereof. And we really thought these were generalizable themes by which organizations could begin to assess their culture and operationalize inclusion. The most predominant theme was discrimination, and it manifested most as unequal expectations, either performance standards or professionalism standards, as well as microaggressions. And then there's 6 other themes here. For the sake of time, I'm not going to go into it. We can delve deeper into the results, but I'll just highlight a couple in terms of the presence of discrimination. One example or representative quote was, "There are examples, but they're subtle yet apparent. One thing I've noticed is that my residents of color seem to get criticized for things the majority do not, even though they do the same things. There's a microscope applied to them, which again is subtle yet present." Another example about the silent witness, which was a theme, was, "Though my department leader was present for a comment that was insensitive, nothing was said to address that comment made." So sort of the need and call for bystanders to speak up. We also received recommendations, which was really nice in terms of actualizing and operationalizing inclusion and combating some of this. I'm not going to go into all the recommendations again here, except for they anchored on leadership and faculty training, ways to increase diversity, increase accountability in leadership, ways to analyze our organizational policies and promote bystander advocacy. I'll just focus on one. We got a lot of representative quotes around the need for a mandatory education on faculty to accept their implicit bias and combat these biases. And while there are some issues to date on the benefits of unconscious bias training, regardless, we did institute mandatory unconscious bias training across the enterprise. Another example was this idea of to promote bystander advocacy as a solution. So having people speak up and the need to speak up over not. So this quote was, "Older generation attendings do not handle racist and sexist interactions appropriately. When they see it, it's not enough to be racist and sexist yourself. You sort of have to stand up for others when those comments are made." So we actually launched a Speak Up campaign in response to that. The next few minutes, I'm going to talk about how we then did a closer look anchored to our blueprint or strategic blueprint for advancing equity and inclusion across the enterprise in efforts to link inclusion and diversity efforts into existing wellness initiatives and professionalism standards. And so we wanted to look at the intersection of inclusion with wellness and professionalism. And not surprisingly, what we did find when we did this, again, looking at our narratives, was that we did find that lack of inclusion and those themes that we identified earlier were related to changes in blood pressure, depression, stress, post-traumatic stress disorder, changes in sleep behavior, and anxiety. So this had a true impact on wellness of our employees, of our students, of our trainees. And so how do we move beyond wellness initiatives that maybe do an ice cream social or focus on sort of this aggregate like event, rather than seeing the ways in which wellness impacts those that are marginalized in our institutions? We also wanted to look at how professionalism related to inclusion. And so we use the DAS to sort of hone in on some of the professionalism questions, which were around, I've considered changing jobs due to inappropriate, disruptive, and unprofessional behaviors. And what we found when we did this deeper dive was that BIPOC and racial and ethnic, sexual and gender minoritized groups, along with females, were significantly less likely to leave an institution due to unprofessional behaviors, being subject to unprofessional behaviors. They were also more likely, I was trying to do something fancy with removing this other box there and I failed, but there should be another box here that says essentially that they're also more likely to value professionalism and the measurement of professionalism. And we wanted to understand why that was. So again, we analyzed our collective narratives anchoring to these two questions, and we found two salient themes. I'm not going to read the quotes, but I'm going to talk about the themes. Essentially, BIPOC individuals experience professionalism differently in an organization. They report greater infringements on their professionalism boundaries while subject to greater scrutiny over their professionalism behaviors, which is a really hard thing to navigate. I'm going to pause for a second so you can take in these quotes, but I think that's a key theme that we wanted to, that was really powerful that I wanted to highlight. The second was this tension between the need to assimilate or conform versus leave. And what we found was if you're minoritized in any way, that you felt the pressure to sort of be a certain way and not be able to be your authentic self within the organization and advance and succeed. And this is really problematic given the greatest barrier to belonging is actually this idea of fitting in, according to Brené Brown. And so our key take-homes here were we needed to revisit standards that originated with a narrow lens, given the homogeneity of our profession. So we really had to revisit professionalism standards, but we also had to standardize how it was operationalized so everyone faces equal scrutiny. So clearly here at our organization, we found that professionalism was weaponized. And so we needed a way to sort of mitigate that. I didn't get into some of the future results and how some of our results improved by our efforts, but I think that was covered by other panelists. And so with that, I will stop.
Thank you all. So first of all, thank you for those presentations. I think they were so incredibly insightful. I certainly learned a lot from everything that you have shared. As a developmental psychologist, I can't help but make the comparison of I loved how each of you are kind of at a different developmental stage when it comes to the DES. And so I think we covered a really wonderful broad range of like, if you're thinking on using the DES, what are some ways that you can definitely engage your campus as well as use those results. And then I loved, kind of ending with this conversation of like, okay, so how do we use it for strategic planning, but also how do we combine it with other data collection methods in order to really make the most of those results. So thank you so much for your presentations. And so now we're going to go into the moderated panel discussion portion of this. First of all, I realized I didn't even introduce myself in the beginning. So my name is Lynn Hernandez. I am the Assistant Vice Chancellor for Diversity and Inclusion at UMass Chan Medical School. And we are UMass Chan is one of the original developers of the DES, or it's the home of the DES. And so we are so just feel so privileged to not only have Sharina Person with us, but really to be able to engage in these conversations. So like I said, I am also myself learning from from what you've shared. So I have a couple of questions that just to kind of get this moderated portion started, but then we do have some time dedicated for the audience to ask questions. And so I do have a list of questions to answer, sorry, not to answer, but to ask, and I'm going to tailor those according to what I saw in the Slido that you all shared. So the first question that I have, I did see a lot of interest in just wanting to know how to turn results into practice. And I think we saw a lot of that, particularly as you shared your presentations, but I'm also wondering, I saw a lot of strategic planning being mentioned also in the Slido. So would love to hear from all of you how you incorporated the DES not only into your strategic plan, but also into developing initiatives that we're going to go into your strategic plan. And I'll just let anybody kind of jump in and answer that question.
I'll be glad to answer since we, our office was new and the DES was one of our baseline. One of the things we also, before embarking on the strategic plan, we wanted to engage the leaders. And I didn't mention that, but with the DES and all the responses, there was a gap between what the leaders said and the faculty said. So the leaders were way everything is rosy and great. And, like they were in the 70, 75%, and the faculty were like in the 40, 50%. So we knew that for our strategic plan to get the buy-in of the leaders, we needed to tell them what we found. So the first step we did, we presented the results of the 2015 to all department chairs and leaders in our institution. So they can see what the faculty said. And they were really, really just shocked because they had some ideas and that's got them that they wanted to take these results and then develop individual strategic plans with benchmarks for each department. And then we collectively put this all together on one School of Medicine plan, because we didn't want us to be the only ones at the office, to be responsible for achieving results. They also, if we don't go down to the units and they make a culture change, environment change, no matter what we did, we're not going to get there. So that's why we felt like, based on the results, each department needs to develop a strategic plan with benchmarks that really tailored to their departments. And then we took all this and made like an overall plan. So then they are also responsible in achieving results. So it was a little bit different than other, like you have like a center or department, it was a little bit different because we can push things, but if the leaders that they think everything rosy did not see how important, and they themselves not decided to make a change, we're not going to move the needle. So that's how we went about developing our strategic plan.
I would say we were sort of fortunate. We had a new change in administration a couple of years before the office was developed, and a very progressive president and new leadership who understood the importance of all of our staff, how we all work together to complement and to provide patient care. So all of this, it was like a perfect storm, but it wasn't a storm. It was great because this was right at the beginning of the strategic planning for Kennedy Krieger Institute for the next 5 years. So EDI undergirded all of the different pillars that we were looking at: patient access, workforce development, all of the different areas that we were trying to improve upon and be very self-reflective. And so I think this helped in some of the work. It helped to give more resources actually to our office, so we could address some of these issues and expand the support and the resources for all of our staff. So I'm hoping the engagement piece of it is really critically important, and I think it helped to help people, everyone who had taken the test, to self-reflect on where they were and the work environment, and so that has been instrumental in our strategic plan and for our office and for the Institute at large.
I'll just add a few comments to that. We launched a 5-year strategic plan in 2015, and we then began baseline assessments for organizational readiness, and our diversity engagement survey was one of those baseline surveys. We culminated that in a strategic planning retreat, and we presented the first set of our DES results at that retreat, the quantitative deeper dive that we did, as well as the qualitative. And the CMOs, CEOs across the enterprise, as well as the deans across the schools were present and sort of available to sort of synthesize that information and sort of think about that. Some of the other surveys, not to talk about it, that we used was sort of the IHI, Organizational Readiness Survey for Equity, and then we used the DES for inclusion. And the idea here was we wanted to create a culture of inclusion. The other part of the strategic plan that I thought was important was that we didn't want these efforts of equity or inclusion to be siloed activities that are sort of relegated to one office or to a champion, et cetera. But we wanted the culture to be that they saw them as integral to the daily operations and functioning of any well-functioning organization. And so to do that, we needed to figure out ways in which inclusion intersected with things that they already prioritize, like professionalism, like wellness. And that was sort of the ways in which we baked it into the strategic planning.
Thank you all. And so my next question has to do with engagement. I would love to hear how you all just got people ready to take the DES, to like be on the lookout for the DES and then to actually take it? How, what does your campaigning look like, or yeah, your engagement strategies? Dr. Fahd, I saw that in your follow-ups, I think you went from like 33% to 37%. So, what happened like in between that you actually were able to kind of increase that response rate? And then again, the same question for Dr. Belcher and Dr. Isola.
So I think, like somebody said, like having a champions and leaders, like it's very, very important. We also, the office was established for diversity when we had like our first African-American, very charismatic dean and vice president. And he believed in this, and I think his support, as I mentioned, when the department chairs, each one of them developed their own strategic plan and benchmarks, this became part of their annual department reviews. Diversity and inclusion never been as part, like as they report on their productivity in research, in clinical care, on their education, like publications of their faculty, the success, revenues, what they put as benchmarks for diversity and inclusion became also part of this. In their report, the diversity dashboard, the fact dashboard was part of their report to show in their dashboard what did they do in the recruitment, what they, like the makeup of their faculty. So I think in 2 years, all of a sudden, because we really got the backup when we decided to do all these initiatives. There was nothing done for women before, like celebrating women that they became professors and inviting the chairs to talk about their achievements. Doing like we had when we found that there are a lot of, the DS2 was very rich and we had a lot of comments in there. We listened to the comments of the students and of the women. Especially the URM students. And immediately the senior associate dean for medical education, the dean and other leaders in the school, we had a town hall meeting with all the students and addressed their concerns. So I think what happened, usually when you do surveys and the faculty and the campus doesn't see any reaction to it, they just don't fill out surveys anymore. But what happened is they found that we responded to the survey. We did initiatives, we did town hall meetings, so when they found that there is a response to the first survey, this encouraged them. They said, yes, if we put something in there, something is gonna happen. And I didn't present, but we made a lot of other initiatives after the follow-up surveys, but I didn't put that because I wanted just to focus on that. But I think when people see that you react and respond to their survey, then they're encouraged to fill another one. But a lot of time in our campuses and academic institutions, we have all these surveys and we don't know what happened with responses. So feedback is really, and initiatives were really important for us.
I think also the feedback and communicating of a variety of strategies. So it can't just be at the director's meeting or at grand rounds or faculty meeting. And there are a lot of, I'll call these individual essential employees that are not at the computer all of the time. They are really working to ensure that we have a healthy environment. The infrastructure they're doing, mostly focused on patient care, housekeeping, people who provide the food and recreational services. They're fundamentally important parts that are not sitting at the computer all the time. So it was also a way of, how do we get this message? How do they feel that that we are engaged with them as well? And how do we put, as most people do have cell phones, QR codes, how do we share this information? As I said, we have it on our intranet site, we put out an annual report that has all of this information in it, but also it's kind of in these shared sessions, which has been, I mean, they're Zoom, they've been Zoom now, but kind of just being able to connect with a variety, all of our scholars, our trainees, our workforce, that is key, and to let them know it's you are important. We want to know what you think.
I may sort of talk about a little bit about the barriers, because I think that wasn't covered as much by the other panelists, but there were true barriers, I think, to response rates. I think there's fear of retaliation. I think impunity and anonymity are things for both our call for narratives illuminated that people would say, I'm afraid to even respond to this. I don't know where the results are going. This is why I didn't respond to the DES. And so I think we have to acknowledge that. The other part that we found a great tension is with the desire to get more granular results at the department, et cetera, level, you lose anonymity, because sometimes the degree of minoritized groups in those departments are so slim, it's very identifiable at some point. And so those were the tensions that we were facing. And so what we tried to do to mitigate those was like, let's not let the perfect be the enemy of the good. The response rate is what it is. Let's look at the non-responder characteristics and the responder characteristics. Let's see if our survey is representative of the whole. Let's see what generalizable themes there are and see if they cross several departments. And then let's anchor on change based on that. And so that's what we ended up doing.
These are all really great suggestions. And just to acknowledge the chat, there's some really great suggestions also being mentioned here. Some folks have been sharing the results of the DES on their website in a very public way to make sure that results are transparent and that people have access to it. And then there is a question about what that I wanted to get. Oh, what is the best response rate that you all have seen? And again, how did you get there? And I think we heard a little bit about how you got there, but I don't know if people want to actually quantify what the best response rate was, or
Mona's was the hardest. Dr. Vlog's was the highest I've heard, I think.
Yeah.
Yes, I think ours was we just have done it once, 30%. So we're gonna try to follow that and get increased.
I'll say that's common, for around that response rate is common. There may have been one or two institutions that have gotten higher than that, but it's more common for institutions to be somewhere around that 30%.
Yeah, I wish we have more, but the thing is too, we were happy to see the distribution of the responses. Like everybody was engaged in the response, faculty, I can pull that, table, faculty, residents, students, and the leaders, there several of them put the numbers. I know it's small, but you don't have that many leaders, but we had about 42 leaders, like department chairs and deans and health system leaders responded, which was good to let us know that they are up in the clouds. But anyway, it was good to see that.
Oh, I just want to respond to something in the chat in terms of being able to convince your institution if you have less than a 50% response rate. If you think about Press Ganey or HCAHPS or CGCAHPS or some of those patient experience surveys that drive institutional performance on patient care side, their response rates are 22% or less nationwide. So I think we need to be really mindful of not setting the highest bar for equity and inclusion like we tend to do when the norms in other areas are accepted pervasively. The other thing you can do is start to compare and demonstrate with your respondent characteristics how representative this is, and start to benchmark. So when we look at when we looked at our qualitative data, we were able to show that except for, as someone alluded to, the executive leadership, we were finding the same themes across every position, across every department, across every age cohort, et cetera. So you can start to demonstrate the robustness of the representation across your own sample, and then how that sample is in part representative of the whole in terms of characteristics. And we know from surveys nationally, all types of surveys, that those that are motivated to respond are either motivated to respond because they have an issue, or they want to praise the institution. So you're always going to have a certain degree of selection bias, but I think that's okay. We want to hear from those that are that have a problem, because that's where we need to focus our attention to fix the areas where people are complaining. And so that is the case that I made to our institution around response rates.
It's a great point. Thank you so much. So one question that came up in the chat, and frankly, one question which also aligns with the question that I have is, it's interesting. So as strategic plans are being developed, and we're also tasking our departments to develop their own little mini strategic plans, a lot of departments are coming up with a desire to collect their own data in terms of what's going on in their departments. And so a question that came up in the chat that reminded me of this struggle that we're trying to kind of navigate, or this challenge, I guess, that we're trying to navigate right now, is how do you kind of communicate to departments how they can potentially use the DES to inform that process? Or how do you encourage them to then do their own data collection without it impacting your DES results, and particularly, not over fatiguing respondents in terms of taking so many climate studies or climate assessments?
I think,
Oh, go ahead. Are you
well, well, all I was going to say is sometimes it takes a coordination too, because at our HR department, there's things that we have to do for CAR, for JCAHO. We have all these accreditation bodies that need these types of climate surveys, and with the state. So I think it's a coordination is one thing. The thing that is nice about the DES is it doesn't take a tremendous amount of time. I sort of can make the case for getting a lot of information out of a small period of time compared to some of the other climate studies that we do. And hopefully, because we're presenting the information across a variety of groups, they're understanding the value and how they see that the results are tied into the change and the resources that the workforce can avail themselves to. So hopefully they can see that we're going to connect the dots for them. So it was interesting. I was just going to say, so the thing about trying to look at the demographic of who responds and compare that to the workforce demographic, I think we had quite a bit. It's a voluntary choice to put down your race and ethnicity when you're as an employee. But even from the 2 years in between, we've had more people understanding that this is important to us. And so our rates of reporting race are more closer to over 90% now, and the different demographics. So just in that sense, it's an increase like 10 to 15%, just so people are self-identifying with all these different areas that maybe before they wouldn't have.
That's a great point. Our response rates have gone up in that way too, just broadly, I think, as people understand the survey and the fear like sort of diminishes a little bit. They understand the purpose and et cetera. I just wanted to underscore one of the comments in the chat that I think is a great idea. Departments paying for it. So that's like a great way to sort of get the chairs to care about response rates. We, what we did as a strategy was we administrated it once across the enterprise, because I think the survey burden of doing it sort of at multiple places at different times would be challenging. But we did lean on or have select one or two departments that we're going to do a deeper dive in when by their volunteering and so they further enhance marketing on their particular department, so we could get to a response rate where we could still preserve anonymity within that department if we were going to analyze their specific results. So that was an idea that also I'd put out there.
Dr. Fod, I see that your hand is up. Go
Yeah,
ahead.
so I think I wanted to answer, like about if the departments are, collecting their own data and how we can coordinate that. So one of the things that really helped us is when we first started after the baseline, we asked each chair to nominate a faculty. And now we have a staff also liaison, a faculty from each representative of each department and each unit to serve as advisors to or linked to the office, and we meet with them on a regular basis. So those liaison between the department or the units and the Office of Diversity, Equity, and Inclusion, they know what our activities, our initiatives, our plan, and we listen to them, what they need in their departments. We also develop plans based on that. So we know what's happening in the departments, and they are the ones to communicate with their chairs or unit leader what's happening, and they coordinate with us. So those, like faculty and staff liaisons between the departments and units and our office are very, very valuable. Because we have 23 departments and then other units. So for us, without knowing what's happening there, and then we give them some autonomy, a lot of them based on their size. Some started, created a position vice chair of culture and diversity. Some others have like a group, like 2 or 3 people that they're the diversity inclusion group. Some others, they have women, groups, smaller other than our big AMWA group. Some have diversity, so we let them do what they want to do. But in the same time, these liaisons and these regular meetings, and for sure communications are very important. That's why we coordinate that. And then we highlight their successes, what they do in their departments. Like if they have a role model or something happened, we in our newsletter, we always try to highlight what's happening in these departments and units.
Fantastic. Thank you so much. So, the intention of this conference that we put together was really networking purposes. We wanted to hear from other folks, how they, again, launched the DES, what they did with the results, how they used it to inform the strategic planning. But we really also wanted this to be kind of like a think tank. I assume that everybody came here because you are also either responsible for administering some kind of climate survey or doing something with the results or communicating the results. And I am seeing some great comments and advice here on the chat. And so I am going to open it up for folks to just either ask questions. Oops, sorry, not yet. Oh, sorry. We're not doing the breakout sessions yet. Sorry. I'm just going to, I don't know if did everybody get that invitation for breakout rooms, or was that just me? Oh, sorry. Okay. Ignore what I just said. So basically, what we're going to do is I'm just going to open it up for questions from the audience, as well as if folks have strategies, tips that really worked for them. I would love to hear from you all. Again, this is supposed to be networking, brainstorming session. And so I think we can learn so much from each other. So please do feel free to share or ask your question to our panelists.
I'm sorry, Lynn, are we going to the breakouts now?
Not yet. No, sorry. I had gotten a little pop-up for breakouts and I assumed that everybody had gotten the invitation, but I realized now that that just not everybody saw that. So not yet. So I think right now, but we do, I just see 2 hands up. So I think I saw Cheryl Huron's hand up first, and then we'll go to Jose Rodriguez.
Yeah, hi, everyone. First of all, thank you for this amazing discussion. Very, very informative. We have been doing, I'm Cheryl Heron at Emory University School of Medicine. We've been doing the DES. We've done it twice thus far. The second time, we really didn't do any interventions accordingly. And the first time, it was really then done by the university writ large, which really made it cumbersome to get the data. The second time, we did it strictly within the School of Medicine. So my question really is about how to take what we have, given it's not ideal in terms of the collection rate and the distribution rate, to form an appropriate trend analysis to be able to speak to the strategic plans that we're developing and or garner support to keep moving the train forward.
Well, I'm not a panelist, but I guess I'll try to answer the question for you. So you do have, even though in the first iteration you had a much broader population, you probably have the ability to kind of scale down to just the School of Medicine. And so that would be my recommendation, is to, from your first iteration, kind of just focus on School of Medicine. And now you have 2 time points that you can really look at trends over time, kind of see your trajectory of where things are going. And that can help you get insights like, Mona and Jaya have found, longitudinally, that can help inform your strategic plan. So that would be my recommendation. And of course, if you need, we're always here. So I'm happy to give advice to you about how you might want to proceed offline.
I was hesitant to chime in because I was thinking about, I don't know, I didn't know the behind the scenes operations of this, but like we use DataStar to administer it. And there are some off the shelf automatic benchmarking stuff that they can give you across the year if you designate the site. So you don't have to do, I'm a health services researcher, so then I always want the raw data and I do a whole bunch of stuff. But if you don't have those resources, you can even benchmark by domain, by like position or characteristic of a respondent, and all those sorts of things, and compare 2 years, which is nice.
Absolutely. As Jaya mentioned, DataStar is our third-party vendor that actually does the hosting of the survey. And so if you plan to do the survey for a third iteration, or even if you just want to do additional reports on the iterations that you've already done, they've been our supplier the entire time, and so they actually have access to all of your data, and so you can get reports like Jaya just mentioned that are specific to School of Medicine and comparisons across years.
And they've been very responsive, like if you tell them exactly what you're looking for, they send you the information.
So that's very helpful. We are planning to do it again next year. So we're trying to get our ducks in a row so that we can get to the response rate and meaningful data that help with our work. So thank you very much.
Awesome. We look forward to talking with you soon then.
Are y'all going to be at LSL, by the way?
Oh, yeah.
All right. Good.
I have my hand up, and I was wondering, there's a few of you who have talked about doing it system-wide, and some of you doing it in the School of Medicine. My position is diversity for the system. So we're doing the hospital, we're doing the academic units in the School of Medicine, outside the School of Medicine, the library, the Cancer Institute and the Mental Health Institute. And this will be the second time that we do this. And my question is, do you see value to doing it system-wide, or is it better just to limit to the School of Medicine? Frankly, because my office has been arranging for the payment, that's why we're doing it system-wide. But I'm not sure if that's what it's designed for or not. And then I got to dive off seriously in 1 minute. I'm supposed to teach it at 8:30 a.m. Utah time, but I'll listen to the answer first.
I mean, I'm biased. We do it system-wide. I see great value in that. We actually then divide up our results by health system versus schools and compare. But yeah, I think I see value.
Yeah, and we're much smaller. But I think you really want to do that, because if you get everyone, then you can slice and dice. The only thing is the resources and the response rates may be different across. But I think it does give you a wealth of information to understand where there are differences across the different climates and environments, I think.
We did for our health system. We used it for the second time. In 2018, the health system asked us, and we did it for the health system. But I agree with Ayola that you need to look at the data by groups, because their culture, what they do, and their benchmarks and like goals are different. But at least this can give you an overall sense of the environment of the whole system. But then it would be good to look at subgroups because
disaggregate.
Yeah, it's a little bit different.
Well, thank you so much.
And that's if you have the resources. If you have the money, do it. That's the thing.
Well, the thing is that if I'm going to survey the hospital, that's 20,000 people. So surveying the rest of the health system is peanuts. So it's essentially paid for by the hospital School of Medicine. But thank you so much for this. I found great comfort and value in this. I got to go. It's wonderful. I hope I see all y'all at GDI and at LSL in a few weeks.
Any other questions that folks have, or again, things that you just want to share in terms of your experience? Dr. George shared here that they got their response rate to 52%. I think we were all just like, wow, we aspire to that. So Dr. George, if you want to share a little bit about how you did that. And I think you did, but I don't know if you wanted to add a little bit, or if somebody has a question for Dr. George.
Hi, everyone. I apologize for not being on camera right now. I'm not a doctor, although it sounds quite nice, but yeah, we were able to achieve a 52% response rate, which was incredible for us. Like I said in my comment, it was really about how we campaigned it. It was important for our staff to know that this was a survey that was completely anonymous and done outside of human resources. We have pockets within our institution where departments will take it upon themselves to do surveys, and we typically discourage that because that's how people feel like, oh well, someone's going to see what I said. And so to combat that, when we did our institution-wide survey, we stressed that this was really anonymous. Not even the administrators behind the scenes could see who said what. And we encouraged people to be honest because we wanted their voices to be heard. And that was actually our tagline. It was be heard. This year, we're using a tagline, your voice matters. It aligns with a lot of the conversation around mattering over the past 2 years, and especially with the U.S. Surgeon General's report about inclusivity in the workplace and equity. So that's our approach for this year's survey. So it's been a while. Hopefully we can achieve the 52% or even go higher than that. But it took a lot of effort. Like I said in my comment, we had a dedicated resource to employee engagement. That's important as well. So not just having folks volunteer to champion this work, but really having someone that is the go-to and the point of contact for managers and staff. So that was really helpful as well. But the initial message that we sent to our institution was actually from our dean, who is effectively our CEO. And so having that voice of leadership set the tone for the importance of the survey, really sent a message to our staff that this was something that we're taking seriously. We're not surveying just to survey. We actually plan on doing something with the results. So that was some of the key things that I think helped build trust. Also, I should mention that we had a pretty robust D&I program before the survey. So trust was being built already. So people kind of trusted us. They felt like, you know, we were telling the truth when we said that the survey was really anonymous and that we were actually going to do something with the results. And I'm happy to connect with anybody offline who wants to know more.
That's great. Thank you so much for sharing that. And I think those are definitely, I jotted down everything that you said to make sure that we implement that on our ends. And I think we heard a little bit about that, particularly from our panelists and engaging in similar efforts. So thank you. Jamie Smith, I see your hand is up.
Hi, there's actually three of us here. This is Dr. Smith, Patricia Hilchio, and I'm Adam Caselas here at Roswell Park Comprehensive Cancer Center. A question I had is, a lot of these surveys I know are administered online through email. Has there been thought or consideration given to having participants, and it's probably not easy to do with larger populations, but our graduate program is about 100 students. So would it be easier to have them come to a destination and do it on their phones in person to ensure, I hate to use the term compliance with this, but ensure participation in the survey and be a little more engaging that way? So.
I do think the ability to do it on your phone facilitates sort of greater response from those that are not at a desk, you know, as was alluded to earlier. However, I wonder how it would be. I think people about sort of carving out a time and space for them to come to you to fill it out. Like, I'm not sure whether that would be effective or not in terms of anonymity and other things, or people's concerns about that just broadly. But I'm curious to see what others think.
You know, the only group that you could do that with are the students, because, you know, like you can do that after, you know, like in-person lecture or something, but you can't do that with faculty or the residents or the staff, you know, like, and I just don't know about, you're not going to have like equal way of administering the survey, you know, like as a researcher, I think that you need to have some consistency, because then you're going to have a lot of students responding higher response rate than others, you know, like I think I agree too that having it easy to do it on phone, iPad, computer, I think that would be very valuable to increase the response rate. And also, as we heard from Vanessa, you know, like the communications, encouraging people and really tell them why it matters to hear from them, then I think it's better. But I would prefer that we have consistency in the way we administer the survey. Unless you're just doing it for the students only, you know, so that's a different thing.
Thank you.
Any other questions before we move on to the next portion of our meeting here? Okay, well, please help me thank our panelists. You know, you could either raise your hands, show an emoji, show them some love for just, you know, dedicating their time and their efforts and sharing their experience. It was, I learned a great deal, and I know that sentiment is probably shared by many folks here. So what we're going to do now is, again, I mentioned this is supposed to be a networking event. We want folks who are doing the work to really engage in conversation and maybe troubleshoot together, as well as share experiences. What are some best practices that you have kind of discovered in doing the work, but also kind of figure out a way to navigate some challenges, or give us kind of a little warning of a challenge that we may not be anticipating, but you encountered. We want this to be like a think tank, a community of practice. So what we're going to do now is we're going to create 3 breakout rooms, and folks can choose the breakout rooms that they want to be in. The topics for each of the breakout rooms, and as soon as we open up the breakout rooms, you will see the title, but the topics are strategic planning. So folks who may want to use the DES or any other climate assessment to, to inform the strategic planning process. And the panelist that's going to be joining that room is Dr. Mona Fahd. And then we have one focused on preparing your campus for the DES or climate survey, like what, campaigning, messaging, what are some of the strategies that have worked really well? And Dr. Belcher is going to join that breakout room. And then the third keep calling it focus group. The third breakout room that we have is going to focus on unpacking your results. Once you have the results, what do you do with them? Do you collect more data, or how do you communicate it? So again, unpacking those results. And Dr. Jaya Isola is going to join that breakout room. Now, while we do have a panelist in each breakout room, they are not going to be responsible for facilitating the conversation. They are going to be part of the conversation with all of you. And so again, this is a really great opportunity for you to share best practices. And we do have a couple of guiding questions for you all. But when you go in the breakout room, first, don't forget to introduce yourselves. You're making new colleagues here, new friends. And so, make sure that you introduce yourself, and then start talking about, again, the best practices and the challenges that you've navigated. We're going to spend about 20 minutes in the focus. I keep calling it a focus group. In my head, it is kind of like a focus group. In the breakout room, you're going to have about 20 to 25 minutes, and at the end, we are going to wrap up, and it would be great for folks to then come out and share, what is something that you learned in your breakout room session. So any questions? No, there was a lot there. All right, so I believe that the rooms have been opened, so you all should have received. There's drilling happening above me. I hope you don't hear that. I hope that you all received the invitation, and I will see you on the other side.
I don't have an invitation. I have just an unassigned room.
Okay, let's.
When you go to the bottom, I think you can join. If you
Okay,
go all
I
the way
saw
to the
that.
bottom,
Okay, I did see that.
you
Thank
can
you.
join your group.
Oh, thank you. Okay, so I'm just taking a peek at the different breakout rooms. It looks like preparing your campus has 7 folks. Unpacking your results has 5, and then the DES strategic planning only has 2. So I'm going to go ahead and join that one. That's Mona Fahd's group. I don't know. Do you all see who's in each breakout room or no? You do see it.
Yeah.
Oh, okay.
Yeah, we
So
can
yeah,
see.
so Mona only has 1 other person in there. So
Okay.
If folks want to just
Join.
join in on that discussion to kind of help out a little bit, that would be great.
Great.
Yeah, because then unpacking your results has 5 people, and then preparing your campus has 7.
I think maybe I'll join the preparing your canvas just because it's like no one else from here is in that one.
Okay.
Yeah.
So John Jay is there.
Okay.
Yeah.
Yeah, I was
Um,
thinking, I think that's the only one I would,
Okay,
Okay.
go for it.
I'm gonna
Go for it.
join too.
All right. I'm gonna go. Okay.
Why can't I get in?
Oh, you know what? I forgot to include the guiding questions.
You can, I think you can broadcast them now still.
I am. That's what I'm gonna do. Too much. Let me see. Uh-oh. Not letting me paste it.
It doesn't let you do it in the chat. You have to type it in.
Okay.
You have the slide?
Candace has the slide.
Oh, where is Candace?
She went to DS and strategic planning. I think folks got the general.
They can, yeah, they can
Yeah.
probably figure it out. I think it went well.
I think it's going really well. Yeah. I think really good. Sorry, talk amongst yourself. I realize I'm talking and trying to type at the same time, and it's not. And I'm typing what I'm saying instead of typing what I'm supposed to.
Talk among yourselves. It's like, oh, okay.
Sorry. Oh, and it's like the broadcast is doing it in chunks instead of one collective message.
You know, I'm a firm believer everything happens for a reason, and perhaps this allows them to have more organic
Yeah,
conversation.
just to talk. Yep.
I mean, that's the whole point of we wanted this to be a more organic conversation. We wanted folks to kind of do what they were doing, like which is like chiming in, talking. We wanted to drink, so this is perfect. All right. Oh wait, there is a way that I can broadcast the message to everybody. And I can put it in the chat and then everybody sees it.
Okay.
Sharina, I think you're gonna get a lot of emails after this.
Yeah.
But because I frankly have even like learned so much.
It was good. Good information. I'm surprised there weren't more people from UMass, but that's I think that
people.
Yeah, where are our people? But I think they think that they already know about it, so they don't need to know about it.
Yeah, I didn't recognize a single person from UMass.
I only saw Yokor. That's the only person I noticed that recognized their name. I was looking through the names. That's the only name I recognized.
One of my analysts was on the Julie Flahey.
Okay. We can look at the attendance later to kind of match up emails, but yeah, I didn't see that many people from UMass on there at all. People that I knew, no. It was just our office. Sharina had a person, and then I think a Yokor. That was it.
I know.
Yeah.
It's okay. I mean,
yeah.
And now to me, like I think hopefully, they see us as like, I don't know, a thought partner in this with the other.
Yeah.
I think, and we did say it was going to be a networking event. I have certainly done some networking. People have been chatting with people.
Yeah.
So Vanessa George, she typed in like when she shared, and I was like, can you share this with the entire group? Because this is really useful information. And then that's when
What school is she from?
Cornell.
Okay.
NYU, or sorry, in New York.
And
then yeah, and it sounds like I had some people just private message me saying, let's do a little meetup at LSL.
Nice.
Yeah.
So yeah. Sharina, anything that you I'm gonna just toss it right back to Marlena and you for closing remarks, but anything that you want to make sure that gets mentioned
No, not really. I mean, no, most of these external people came from our client list. So
Yeah.
they know how to get in touch
Okay.
with us too if they want to, do the DES again. So
Mhm.
not a whole lot, I think. I have to say beyond what I've already said, just to thank them.
Yeah. Yeah, same here, just to thank you. I mean, we definitely people like we thought would drop off after they put them in breakout groups. Most people come to listen. I think we only have 18 people left.
That
including us.
said, I mean, I thought it was just gonna be us once we said breakout.
Right, no, exactly. So some people did
I'll
say, which
take
is
the
good.
18.
Yeah, we
'Cause
knew.
I know-
I mean, soon as
I
you
know
have to
that
get
I've
put in
joined
breakout.
breakout. Yeah, when I've joined conferences and they're like, we're gonna do breakout rooms. And I'm usually just like listening in the background. I'm like, I am not ready to like be on camera or in a breakout room. So I leave sometimes.
People sign
So I
off, yeah.
assumed people were gonna do that. But I think 18 people is still very good. And just taking a peek at the different conversations, each one of them now is like pretty well represented. So
Mhm.
yeah.
Yeah. And we
Yeah, we have-
had at our peak 40.
we had our people, yeah.
Good. Mhm.
Yeah, and most people are on the preparing your campus for the DES conversation.
Mhm. Mhm.
And then
The
5
unpacking results.
unpacking results, yeah. Which Ajaya was awesome. Oh
Mhm.
my gosh.
Okay. Yeah.
She was awesome. And I love that crowdsourcing method that she used.
The questions.
Yeah, so in terms of like getting qualitative results, not running
Mhm.
focus groups or doing individual interviews, but just kind of asking people for anonymous like
Yeah.
comments. And then she got some really good ones in terms of what she showed.
Mm-hmm.
Yeah. So that's good. All right. So let me see, we have about 15 minutes left. So I'm gonna just peek in
Yeah.
just to see how it's going. See you in a bit.
I'm exhausted. I would join one, but I'm.
You said you're exhausted? What's going on? Just life.
No, well, I have a virtual site visit starting tomorrow, Wednesday, Thursday, and Friday, that of course I did not finish until,
Last night.
no, actually I finished that Sunday night.
Okay.
Yesterday, no, I take that back. It wasn't Sunday night. It was Monday during the day.
Mhm.
Then I have this afternoon, I have I'm speaking virtually at the University of Arkansas, something with their diversity, equity, and social justice or something about that. And I'm talking about research bias
Mm,
and lies and statistics is what I call it. So it's from a
nice.
statistician's point of view. So
Okay.
I had not done any of that presentation. I did that.
Well, we have to get you to bring that to us as well.
So it's really interesting. I wanted to have a conversation with you to give you a heads up, not a bad heads up, it's actually, I guess, a good heads up, but the Cancer Center is prepared or trying to prepare, organize to apply for NCI designation. And one of the required elements is that they have to have associate director for diversity, equity, and inclusion that has to develop a diversity plan for the Cancer Center. And so I have actually been appointed as the inaugural AD for diversity, equity, and inclusion. So I look forward to working with you.
Yes, no, congratulations. Happy to
In
help.
your office. So
Yeah.
I wanted to give you a heads up before it's announced. I think Thursday. I don't know how widely it'll be announced. I know it'll be announced to Cancer Center members, but anyway.
When did they announce the Cancer Center members? I don't think I saw that.
Oh, so the Cancer Center The Cancer Center has actually always existed. I didn't realize this myself. Because it
Okay,
was
okay.
not very
Mm-mm.
out there. But anyway, Michael Green is actually the director of the Cancer Center.
Got it. Okay.
And so it has not been structured in a way that is consistent with how the National Cancer Institute views cancer centers. And so that's one of the things I've actually been working with them for the last 2 years to get them closer.
Good, good. Yeah.
Because I actually used to serve on a nondescript committee called Subcommittee A, which was the committee that actually reviewed all cancer centers for the National Cancer Institute and did site visits. So that's one of the leftover things. I'm doing a site visit, tomorrow for
Okay.
LCI. But so anywho, yeah. So the Cancer Center is not as prominent as it should be, or
Right.
that's why you have no idea.
I was gonna say I didn't know who the members were, and I didn't know anything about it.
Yeah, but he is the director of the Cancer Center, and Jonathan Gerber is the deputy director of the Cancer Center.
Okay. And so now you're going to be the new DEI lead for the Cancer Center.
For the Cancer Center, yeah.
Good. How many members are part of our Cancer Center?
I think we have about 130-ish people who are members.
Okay.
Cancer Center has 4 programs, like 10 shared facilities that they have, and Central Mass is its catchment area, so that's the area that they're interested in. That's the area they're interested in impacting, and so there's so many components in this whole beast. You have to deal with community outreach and engagement.
Right.
You have to deal with science that directly impacts your catchment area. Not just basic science, but population science as well, translational science. There needs to be education components. There needs to be reviews of protocols and clinical trials that need to be going on that people can enroll in. So it's a lot of moving parts.
Okay.
The DEI component is specifically aimed at impacting diversity of cancer center operations. So faculty, the staff, the educational components, etc. So it's kind of a connection of multiple things, like your office, Milagros' office. I would even envision the new Health Equity Collaborative person. So it's going to require interaction with multiple groups. So
let me know.
Yeah, absolutely.
How it can be helpful.
One thing I haven't even mentioned, I'm just kind of having initial thoughts. Well, one thing that may be helpful is addition of one question on the DES, the iteration of this next iteration of the DES that only asks something along the lines of, are you affiliated with the UMass Cancer Center? And then that doesn't have to be primary affiliation, because there's nobody that has a primary affiliation with the Cancer Center per se. But if they are affiliated, then that'll allow us to do analysis, kind of have a baseline assessment for DEI activities for the Cancer Center in the future. So
would that help us with, if we're doing departments, if we can also do affiliations, would that?
Yeah, probably.
Does that make sense? I know people want departments, but we can do departments and affiliations.
Yeah. Yeah.
Because that's the other piece. I don't think anyone's ever mapped all the things that are going on this campus
No,
and all the affiliations or pockets and spaces people are in.
absolutely.
Mhm.
Absolutely. I mean, that could potentially be, a key to why certain values are what they are,
Mhm.
something that we would not have been able to detect because we didn't have the data for it before, if, you have a big group of people who are really impacted by the fact that
Mhm.
the leadership of whatever affiliation,
Yep.
is not really conducive to equity and inclusion,
Yeah.
that's hidden if we don't,
Ask.
ask.
Yeah. No, I think that's a great idea. If we add department and affiliations to the questionnaire.
Mhm.
Yeah. Mhm. No, I think we'll have a better response rate this year.
I think
Mhm.
I absolutely think so because I've been here for all of them, and I
All
can
of them,
tell
right? I know, since the
all of them
beginning.
since the beginning, and I can tell you that you are already ahead of the game in the preparations that you're making, for the survey. The first time
Yeah.
it was cold. It was, there was really no
Mhm.
no preparation.
Right.
Maybe a little bit more the second time.
Mhm.
Third time, I think, which was the last time, was
Yeah.
done. Basically none. I mean,
Yeah.
so you're already ahead of the game. And
Mhm.
I think one of the things that came out of the discussion today, which is really vitally important, I think, is demonstrating what we've already done with the information they've already provided.
And that's the next session. So we
Yeah.
hope to get more UMass people there, but to show kind of full range. This is what we've learned. This is what we've done. This is what we plan to do.
Right.
Continue to stay engaged with us because that's the only way we're going to get better.
Right. Right.
Mhm.
And I think when people feel like we're listening and it's not just data for the sake of data,
Yeah.
they're more willing to share.
Yeah. And I really hope to get our residents and our students. I feel like they're the ones that don't even know about this. So we're trying to definitely reach them, talk to them.
Absolutely.
Mhm.
So
And the residents are like that weird, they're between clinical world, our worlds, and no one reaches out to them.
Right. Who is that golly. I'm seeing her face in my
Deb DeMarco?
yes.
Yeah, it is her. Yeah. But
Okay.
I don't think that they think beyond her office, anybody's listening to them.
Okay.
Yeah.
So is she one of those champions we can get on our side for that?
Yeah, I think she would absolutely help us. And she's leaving after this year. So she's retiring. Yeah, I know. She's good. I like Deb. Yeah,
Isn't me?
I know. So it's going to be starting all back over
my
again. But
God.
hopefully whoever we bring in will have the same, energy and passion that she has. But yeah, she's leaving.
Oh gosh. Okay.
I think they're starting the search soon for her role.
Oh wow.
Mm-hmm. Yeah. She's been at UMass, she said over 30 years. I was like, you do need
Well,
time to rest.
if I could finesse retiring now,
You would, right? I know. No, I was like, more power to you, Deb. Like you've earned it.
exactly.
Yeah.
So I cannot begrudge anybody.
No. She's leaving for good reasons and she wants to travel, still do things. So I get it.
Absolutely. Absolutely. I mean, with her and Mary Zanetti, Mary Zanetti's.
Is she really?
Yeah. Yeah. She's retiring. I think she's retiring too.
We better get it together if she's leaving. I didn't know that. We
That's
really
what
need
I'm
to
saying,
get together.
crafts. Are you
I
kidding
know.
me? You know,
We
she's
need
gonna
that.
stay until we have a replacement, but oh my
But still,
gosh.
the replacement can't figure out all the nooks and crannies she knows. And
The institutional knowledge alone,
oh,
that's going to be lost there.
I didn't know she was leaving.
Yeah, she announced it somewhere.
Oh,
But
no.
yeah, I know she told us. Because I'm
Oh,
so
no.
proud. Like,
That's why she acts the way she does in those meetings. Like just
she doesn't care anymore. Like,
yeah.
whatever.
She's like, I'm gonna tell you the truth.
I know exactly. Oh,
Now that makes a lot of sense.
oh yeah. No more biting her tongue now.
No, that's awful though.
Yeah.
Hmm.
But I have a meeting with the dean on Monday to discuss.
Okay. Good.
So
Hopefully he listens and he's open to. I think even bringing a consult, like have somebody external clean it up and then we can start fresh. Because I just think it's hard internal to do this.
there's so many business practice there. I can't tell you the conversation I had with my staff. I'm like, okay, I can't go back to him to say we can't do this, and we got to come up with a solution. And they say, but these are just the business practices we found out already.
That we found out about, right?
We don't have a clue on the depth of this, and I don't want to say that we can fix this, and we don't know what we're going to encounter. Like,
no, I told you. I was like, there are bodies everywhere.
Oh my God.
there was no way. Because that's what we found out. I told you when Angela was hired. I thought it would be just as easy. Go get this from this one, go get this from this one, and pull together some dashboards and reports.
But
no.
This is a downright cemetery.
This is a cemetery. Oh no, it is. That's why I said
this is a serial killer's dumping ground.
Yes, serial killer's dumping ground. That is the best way to describe it. Yes. And only the serial killer knows
exactly where they are.
Yeah. We have not unearthed anything.
No. We just keep smelling bodies.
Yes. There you go. We smell it, but we don't know where it is.
Exactly.
Yeah. I think it's just hard to clean all this up. It really is.
Wow.
It really is. All right, we have how many people are left? 16. Okay.
Time went by fast.
Yeah.
All right. The fact that people are not coming back immediately is a good indicator. It means that they're talking. So we'll wait. I think it gives it like a minute for folks to leave.
Yeah, I think I saw like a 42-second countdown or something.
Okay.
Yeah.
You're down to 10 now.
All right. Okay, here they come. All right. Okay, so it looks like everybody's back. I hope that you all were able to engage in a very lively, educative, and again, community of practice type of conversation. I hope that you exchange contact information because again, this is a networking event. So what I want to do now is I was able to peek in some of the breakout rooms and then engage in one conversation and wasn't able to go to another one. But I found the conversations that I did go into very engaging. And so I would love for folks to maybe share one thing that they learned from their discussions. It would be great if if you have a representative from your group, but also I think we're a small enough group where folks can just share one thing that they learned in their discussion. Thank you so much, James. It's a team. All right, what I saw that you
one of the things that we were impressed with, and we were sort of I don't want to say commiserating, but the commonalities across different, different places, it seems like we're looking at some of the same barriers and obstacles. So that was sort of empowering. Anyway.
Absolutely. Kelly Grace.
Yes, for me in our breakout room, it was the power and the potential of diverse methodologies and being able to really tell a whole story, and the really creative potential of using the data to make change.
Fantastic. Yeah, since we weren't all allowed to, or not allowed, but we weren't all able to attend each one of the breakout rooms, like we would love to just kind of hear, what you learned so that we can also benefit from the discussion that you had.
I think we had a good discussion. One idea also was to give incentives or randomized incentives through a link that is anonymous link that's added to the survey. I think that I do that for, I was saying I do that for undergrad and graduate students, but I hadn't thought about that for the staff. So I think that was a good idea. And then the other, I think a subject that came up is whether to the implementation strategy, whether it was that you would create your own Qualtrics, SurveyMonkey, or go with the different services, whether you would have the whole thing done by UMass and the analysis and, all the different options that are available to implement the TES. And I'll refer that back to you, Dr. Person. So for your expertise in kind of deciding in unique situations, or all of them have their own, they have similarities, but there are some nuanced differences between what questions people want to ask and how they want to analyze the data. So we sort of got into that type of discussion.
Absolutely. That's one of the services that we provide when we sit down and talk with you. We have a couple of options on how you can administer the survey. Sometimes people have the infrastructure in place to be able to handle all of that themselves. They have other, extensive surveys they want to implement at the same time, and they want to do just one ask. And so we have options to allow you to handle that. If you want us to do everything, we can also do that option as well. And we do consult on occasion with institutions that want to do a deeper dive into analysis. Maybe they don't have the statistical capabilities or personnel to be able to do that. And so we have prepared high-level presentations for institutions to be able to present their results.
Thank you, Dr. Person. Anybody else want to share, again, a best practice that maybe came up, or a challenge that you kind of helped build a roadmap to address? Jaya, I just saw that you unmuted yourself. So
yeah, I will summarize a little. We spent a lot of time talking about the utility of qualitative data to not only unpackage and insights into what you found on your survey, but also to sort of guide strategic interventions. We talked about the simplicity by which qualitative data could be collected, like using stimulus questions via email. But the reason why I wanted to speak was I was really excited about what Finesse was able to do during the pandemic, where she actually collected using a very similar stimulus question post a roadshow. So she would go around to different departments. She'd be presenting. Sorry, I'm stealing your thunder, but I was afraid you wouldn't toot your own horn, so I'm just going to toot it for you. she went around, gave a roadshow around, to talk about race and racism, I believe, and equity and inclusion in this climate. And then afterwards, she basically used a similar stimulus question around, tell us your story of inclusion or something to that effect. And she has 700 responses and stories to sort of analyze now. And so it's rich data with one question. And that's sort of what we unearthed at Penn as well. So the power of that stimulus question. I feel like I've probably did not do it justice, but that's what your question was actually better than how I paraphrased it.
Thanks, Chaya. Just to give a little bit of context, post George Floyd, institution-wide, people were dealing with a range of emotions, as I'm sure you all on this call can relate. And so I partnered with department leaders to host conversations on racism and injustice and meaningful change for their specific department. So we had like an institution-wide town hall, but then I went into the departments to talk about this very sensitive topic, obviously. And people got really honest. Like some folks shared, like, this is the first time I've felt comfortable in 14 years to be able to share my story. And this is the first time I felt safe to talk about these things. But at the end of, and it was a great conversation, but I wanted to collect data so I could analyze it later. So at the end of every of those talks, and I did about 40 of them with different departments, it was a rough time for us D&I folks, as I'm sure we can relate. But I asked at the end of every workshop, what does inclusion look like or feel like at home within the department, not institution-wide, although that's important, but within the department, the space you're in every day, what does inclusion look like and feel like, and what do you need to feel included? And some people said, simple things like, I just need a good morning when I come in. I need to be acknowledged. And some folks gave more structural responses, like, we need to see more representation in our leadership. We got 700 responses to that one question, and I was able to compare across departments, like what the themes are and what people need. And then I gave that data anonymously back to the leadership and said, this is your data. This is for your specific group. This is what people need. Let's take action around it. And for a lot of the departments, I was able to action plan. Some departments built out their own equity and inclusion steering committees. Some departments have like diversity champions. It's like a range of things that people have done, but I've started to do the part 2 of it to see if people's sentiments change or if they felt like there was a difference. So I've done like 3 of those, so we have a lot more to do. But just going back to Jaya's point about the qualitative data, it really is powerful to let people share their thoughts openly, but also anonymously as well.
Thank you so much for sharing that. And that is a great question. I wrote it down. May you borrow it? With permission, I will email you. Anybody else want to share either, something that they've done across maybe all 3 topics, like something that you did to increase engagement? I did hear a couple of questions about incentives. Like, what were your incentives? I think people were brainstorming ideas of what was like an attractive incentive. I know that Holly, you shared that we gave parking, 1 month of free parking, which was kind of a creative way to incentivize folks, but would love to hear, like what kind of incentives you shared or anything else.
This is sort of off topic, but one thing that came up in our group that I thought was really important was the necessity to find somebody to analyze your data who has subject matter expertise in like DEI, which I think is not common. Oftentimes people are either have like a health equity or population health or like more of an epidemiological skill set, and like it's just a different skill set in terms of analyzing your data. And so I thought that was really, really important to highlight. And it reminded me actually of Dr. Duncan always kind of mentioning in our team, like it's important for us to be able to have our specialty areas of expertise within DEI rather than it just kind of being this like, everybody's the expert in all things DEI expectation, because that's simply not true. And also to be able to hone those skills is really important, and to be able to see people as subject matter experts within their field and in that niche area.
That's great. Thank you.
So I was wondering if I can ask, Dr. Ursula, if I can ask, how did you go about getting those responses? You were saying crowdsourcing. So did you send out a survey to those who had responded to the DES, or certain responses that they have? How did you, what were the steps? You're muted.
It's a great question. We did a call for stories campaign. So we did a large lead time, like Vanessa was sort of talking about, where we said, we just want to hear your story of inclusion or lack thereof. We did not isolate it to the respondents of the survey. We did it because the survey was administered enterprise-wide. We just followed up that survey.
Right. So it was right behind it. So people were primed. You went from pre-contemplative to contemplative.
Exactly. And also we compared our table ones, like our demographic breakdown of both the qual and the quant, and we got similar representation. So in other words, even though it wasn't the same sample of people that necessarily responded, but it was representative. They were similar. The same percentage of females responded to both, the same percentage of
and you would have like a Qualtrics survey with these questions. Is that how you did it? So it was anonymous, or how did you?
Yeah, it was one stimulus question with the demographic questions. It was actually two stimulus questions, which was, we want to hear a story. So we said, we deliberately did this. We said, limit your story to 500 words, but we kind of did that because we figured people would want to write a lot, like it would trigger people to think they needed to write a lot. So, because we wanted robust stories, we didn't want like a short answer. And that's what we got. So we got like, I think we got more than 500 words at times. We didn't actually truncate it afterwards. But we sent it out 3 or 4 times, and then it went into it was like a red cap, but it was a red cap, but it wasn't a survey, except for the demographic questions that had discrete responses. The other 2 questions were an open-ended.
Right, just a text box.
Yeah, a text box that you can just really just go at it. And so we asked something about their general stories of inclusion, and then any specific events or, things that they wanted to highlight. And it was those 2 stimulus questions.
Thank you for sharing that. I actually was going to email you that question. What did your crowdsourcing look like? Because that was something that definitely kind of piqued my interest.
Yeah, and I'll put, we've described.
And you that was one of your references that you had?
Yeah, I put.
Okay, so
yeah,
right. So I took a picture of that, so I'll read it.
No worries. And also I'll put the other 2 in there too.
Oh, thank you so much.
Yeah, so you have all 3 references.
Are there any, before we close this out, any questions that you want to ask anybody in this room, panelists, or affirmations that you want to share?
If I could quickly share something that I think really worked for us when we were rolling out our survey, was before we launched the survey, we had like office hours or workshops with managers. So anyone who was a people leader that could expect to get data back, we had workshops to talk about why the survey was important and why they should encourage their staff to take the survey. Because we didn't want managers to feel like we're trying to get data on you to see how bad you are kind of thing. We wanted it to feel like a partnership. So I think that buy-in from the middle managers, the folks that really shape culture, getting their buy-in and helping them understand why it was important, why analyzing this stuff is helpful for their own teams. That buy-in was important, and then they encouraged their staff to take the survey. So I found that to be very helpful.
That's great. Did you partner with like any other like business units like HR or, in order to get that message out?
Yeah, so our HR business partners were our champions. actually, after the survey was done and we spoke to departments individually about their results, we went out with the business partner. So it wasn't like engagement and then the BP separately. We were hand in hand with the business partners because the business partners really know the culture of the departments. And so I think the managers and the department leaders seeing that their BP was there was really helpful.
Absolutely. That's great. Amy, I see that your hand is up.
Yes. So did you find it valuable to have, we're administering the survey to faculty, students, and staff and postdocs. Did you find it valuable to just present like faculty data to faculty and then staff data to staff? Or was it sort of the broad picture, a better approach to like a diverse audience?
In my opinion, it was better to present all of the data to everybody. But we did give department leaders the opportunity to break out that data by faculty, staff, and postdocs. But having a unified like theme, like this is what's going on in your department-wide, regardless of employee status, was helpful. So that way managers didn't feel like, oh, this is a staff problem or this is a faculty problem, because they work closely together anyway, as I'm sure you know, so they impact each other anyway. So if one group is feeling a particular way, it's likely that it can affect the other group. So the unified approach was best in my opinion.
I agree with that, actually. We also presented ours in aggregate to different stakeholders. Obviously, when we presented to executive leadership, we wanted them to see the full gamut of things. I think the one place where when I presented, we did divide it up into university versus health system. So when I presented to like PSOM, our School of Medicine, around their students, or a GME around residents, I did show them their own data as well, or just showed it and highlighted those quotes, highlighted it from the qual part, highlighted those findings from the quant part. But I still zoomed out because I thought it was important for them to see how they did as compared to the whole as well.
That's super helpful. Well, I think we are coming up on time. So I just once again want to say thank you to our panelists and to folks who participated in this meeting. Again, I feel like we all learned a lot, and I think we had a really great discussion. I look forward to connecting with you all in the future. But now I'm going to pass it on to Marlena Duncan and then Sharina Person to close us out today.
Again, just a thank you. This was wonderful. I always learn from others, and I think it's the best way for us to get better collectively as DEI leaders. I heard Vanessa say, moving towards this meaningful change, and I think that's what we're all trying to do in intentional ways. And I'm just happy that you all took the time to spend with us so we could learn from each other. So again, thank you, thank you, thank you. Thank you to our panelists, and thank you to the team at UMass Chan for pulling this together. Really appreciate you all.
I echo everyone's sentiments. Thank you so much. If at any point you need any help from myself or my team in implementing the DES, thinking about your results, how to proceed, please don't hesitate to contact me. We're just an email away.
All right, well, thank you all. I hope that you enjoy your Tuesdays. But then also that you have a smooth week, and I look forward to connecting with you all in the future. Thank you so much.
Thank you.
Thanks, this was great.
Bye.
Thank you.